Hey everyone, welcome to my channel. My name is Girin Ray and I am here to share my preparation strategy for the PG entrances in the upcoming exams. Okay, on this channel you can expect to find some related videos for the preparation for the preparation of the PG entrances and for the MBBS contents and for the daily updates with the upcoming exams. Okay. In this first video, I would like to take a moment to introduce myself. My name is Girin Ray and I have completed my MBBS from the Bardhaman Medical College and have completed my internship in this year. And this year, 2024 Neetpg, I have given exam and I have achieved a decent rank and I have taken admission in MD medicine in the college, but in this video I'm not revealing my college name. One more counseling is left, so I'm waiting for a new good college. Let's finger crossed, and I will reveal the college after the counseling ends. Okay, in this first video I want to take a moment to share about the preparation strategy with multiple revision in this upcoming Neetpg 2025. Okay, so let's start. Whatever platform you have, maybe your PrepLadder, Dbmci, Cerebella, Marrow, DAMS, whatever you have, first of all I would like to expect that by this time you have made all your notes are made, okay, and you have already started your first revision. Okay, let's start from the timeline from the January month. Yeah, I know it's quite bit late to make this video. Okay, let's see. We know no one is sitting idle. Everyone has started their preparation already. Let's give him just a guidelines or to make him sure that he is in the correct pathway. Okay, so let's see. So by this time you have already started your first revision. First revision, I would like to say you must end it by the January and February. Okay, by this in these 2 months I would like to say that you complete your first revision. Yeah, in this first revision you must make sure that while you are reading your notes you must highlight the important points. And how will get to know what are the important points? By collaborating it with the previous year questions. Okay, when you will read the notes, parallel you will do previous 10 years questions, or you will do custom modules from any question bank. Okay, so by that time you will already get to know. And yes, also when you watch any videos from any platform, the faculties already said that these are the important topics, this you need to read before the day of the exam. So automatically everyone gets an overview what are the important topics they need to read for the particular exam. Okay, fine. So the first criteria in this first revision you need to do is that just highlight the important things you need to read for your second revision. Don't think about the exam that is conducting on the 15th June. Okay, just go step by step. Then you complete the subject by the mark date you make for completing that subject. Okay, try to finish the first revision as I told by the January and February end. Okay, February end, and the max to max you can take it till the March 1st. Okay, revision. So first revision we have completed by Jan and Feb. So you got 60 days. You will get March and April month. So you will start the second revision by the end of the first week. Means you have to start the second revision by first week. Whether you will start on the beginning of the first week or end of the first week or mid of the first week, that's as per how your schedule goes. Okay, so we'll start the second revision by the March 1st or so second week, and we'll complete it by the end of the April. So we are getting approx 45 days. I'm taking at an approx. Many up and down comes, many days comes, you can't study, you need to go out, or many of the things I'm keeping at that aside. Okay, then we'll go for the third revision. Third revision will start by the last 2 weeks of the April, and we'll complete it by the May 1st week. Approx 25 days. So 60 days, 45 days and 25 days. Okay, then we will go for the fourth revision. Fourth revision you are getting May second week, third week, fourth week, means 3 weeks you are getting. Approx 21. Okay, I am taking it 18 days. Approx 18 to 20 days. Okay, fifth revision is very important. Last revision, keeping aside, we are starting each and every day, not only for the exam that is coming on the June 15, but yes, but how to prepare ourselves or how to consolidate all the 19 subject content in a day of 10 to 12 days for to study from June 1st to June 13th. These 10 to 12 days are the most important days. In these 10 days you have to study, you have to think that you have to study the whole 19 subjects. It's not possible to learn the every 19 subject line by line in that days. So we are preparing from Jan, so we can consolidate each and every content. Like first of all, you listen, first revision we have given 60 days, second revision we are giving 45 days, third revision we are giving 25 days, fourth revision we are giving 20 days, fifth revision we are giving 12 days. Okay, it means what? We are accumulating and consolidating each and every content into just a concise manner. So it took all the 19 subject contents took a shape of a box and keeps in our mind. Okay, now I would like to say what are the subject sequence to study. This nowadays the question paper is fully integrated. Okay, so we must make sure that the subject you are studying is not getting repeated, so you can save our time, so we can consolidate the content also. Like for example, I am taking, this is my way of studying when I used to read. First of all, I start with anatomy. Okay, anatomy I explained it about the supex, infex, then head and neck, neuro, thorax, abdomen. We know from the nowadays the important part of the anatomy is everyone knows that the anatomy important parts comes from the head and neck and neuro part. Supex also some part is there, mainly the hands, the hand muscles, infex, nerve, and yeah, in supex also the brachial plexus, the three main important nerves, the pathways. There we can integrate with orthopedics. You know, orthopedics, that the nerves are very important. So after completing anatomy, we can directly shift to orthopedics, because anatomy also, in anatomy we are studying about the median nerve, ulnar nerve, radial nerve. In orthopedics also we have to study. So let it be, why to study twice? Why to waste time when you're reading the same thing? Okay, let's integrate both these. So first of all, we read with the anatomy, then we read to orthopedics. Finish. Orthopedics we need to read about the x-rays, the bone fractures. Let that integrate with radiology. Okay, just after completing the orthopedics, we'll get to know in orthopedics we also need to see the radiology pictures. Then after completing just orthopedics, let's go to shift to radiology. Finish. In radiology, you also need to the GI radiology, that is very much integrated with the surgery. Like this, then for example, we start in just now we completed orthopedics. So let's start with the MS musculoskeletal radiology. Okay, we completed musculoskeletal radiology, and then by step each chapter ka heart, nephro, obs-gynae, radiology, all I am taking on the radiology. Then let's end this by GI radiology. And as we entered the GI radiology, it's much more integrated with the surgery, and then here we again enter the surgery. Let's start the surgery with the GI, because GI is the very big content. Let's complete it. Then after surgery, take a day off. Like we have fully integrated anatomy, orthopedic, radiology, surgery. Okay, no problem. Then let's start with the medicinal part. What is that? Physiology, pathology, pharmacology, and the medicine. Let's start with the physiology. First of all, any subject, any chapter you wish to study. Chapter you study the first day, which first day you add those subjects, those chapters in a sequence that you can complete it in a first day. In which chapter you have good grip, keep that in the first day. Like for my time, I like to keep the cardio and the neuro part of the physiology in the second day, because it's quite lengthy and it's quite felt difficult for me to memorize that, because then in neuro many receptors are there that I need to memorize, and that is good, I get to forget very easily. So the cardio I keep in the morning and the neuro I keep in the evening. That is on the day 2. On the day 1 I used to keep nephro, respi, endo, GI, because these are the small topics of the physiology and the general one. In 2 days I can complete the physiology. On the third day, then I go to pathology. it helps me so I can differentiate the pathological changes taking place in the normal human physiology. Okay, then I read about the pharmacological medicine of the respective pathological chapters. All the chapters are the same. Then I did the pharmacology. Yeah, my half of the medicine completes here only. Rest half what I have left, I took my medicine notes and I read that. And when I read the medicine, already everything what I have read in physiology, what I have read in pathology, and what I have read in pathology will automatically come to mind, and it helps to complete my medicine in a very short time span. If I start with the medicine, it would take a very long time. So I started with physiology. So I started this, then I went to pathology, then I went to pharmacology, and then I went to medicine. And then I completed. There's some topics which will not get find in any of the things, like ECG, in case of cardio, in case of neuro, the muscle disorders, then the disease parts, that I will get solely in the medicine part. Okay, everything has a soul content of that subject. Then I will end the by, and then I will complete the medicine. It helps me to complete the medicine in a short time. I will keep that medicine for max to max 3 days. In the further subsequent revision, I'm not talking of the first revision, I'm talking of the second revision, which forms the second revision is the very important point. Third 3 days, yeah, I think it's max good. First day you go for cardio and neuro, second day and cardio and neuro and rheumat also. Rheumat is very short topic, we can complete it. And then on the third day, let's go for SP, endo, GI and hepatology. And what are the chapters left? I think any left? I think no. Whatever is left, maybe we'll complete on the third day, and then we will go for, and then third day by 2 or 3 o'clock we have in the day 1 morning topics. Okay, then we'll take a rest. Yeah, in evening we will try to do the SWT on each and subject. Like for example, you take pathology. Okay, 50 minutes, 50 questions. Let's start from 7 o'clock or 6 o'clock. 6 o'clock to 7 o'clock, I have completed pathology SWT. Because I have read it. I think the number of questions should be very much correct. Only 2 to 3 wrong or 5 to 6 wrong, max to max. Okay. Then 1 hour over. Take 10 to 15 minutes break. And then again you complete physiology. Don't give SWT after complete just the subject, because there you will score good and you will get a overconfidence that I have learned that subject very good. No, that overconfidence is very bad. You read physiology, you read pathology, and you read again in medicine, and then you come to do the SWT. You do the pathology 6 to 7, I told. Take 10 to 15 minutes tea break, and then from 7:45, okay, till 8:45, do the pathology done, and then physiology, SWT done. Okay, fine. 50 questions, 100 question done. This one you can do. Okay, and then you take rest, and then again you at the just before going to dinner you complete the pharmacology SWT. Done pharmacology SWT. Okay, keep rest for that day. Third day over. Fourth day, just give the medicine. Medicine questions are much more, you need to keep your brain. So medicine you give SWT on the fourth day. So medicine SWT, your whole medicinal part is over. Done. You will get the confidence. And from the evening you start studying microbiology. That is also kind of medicine, kinds of infectious disease that comes in the medicine. So we can help you to integrate. You already learned about the microbiological drugs in pharmacology. So it has to more to integrate in the microbiology. If you first start with the systemic microbiology, end with general microbiology. Because just now you come from the medicine, so it helps with the systemic microbiology, and then you end with the general microbiology. Okay, no problem. If systemic microbiology comes of virology, small topic, parasitology, small topic, then biology, mycology. Yeah, I think that these 3 topics are very small, you can cover in a single day. Next day you keep for the systemic bacteriology by the morning. If you read slowly or if you can read fast, is very nice. And then by the end of the day you can complete by the general microbiology. Means 2 to 2.5 days enough for the microbiology. Then go for dermatology. You know why I kept just dermatology after microbiology? I think you can correlate it better. In the mycology, just after all the food diseases like Sporothisenki, then whatever you have, that all the dermatological food is Madura food, you can correlate in the dermatology better. So just after microbiology, you can read the dermatology. There you can integrate so much better that you don't need to read twice about that thing. Same thing. If you read this dermatology 10 to 15 days after, then you need to read again the same thing that is after microbiology. That's what you have read, and again in the dermatology. So better let to save time. Just read the dermatology after microbiology. Over. Here it comes to an end. One thing. You can take rest in between days. I'm just telling the sequence you need to follow for completing your revision so that you can integrate in a better manner. Nothing else than that. Then you go for pediatrics. Let's cover the son and the mother at a total. Let's then go for pediatrics. I think pediatrics is also related to medicine, but yeah, we can relate it. I think just 2 to 5 days, 3 to 5 days before you have read medicine. So we can cover pediatrics in a very, very short span of time, hardly 2 days I think is maximum. 1.1 to 1.5 days for systemic, then for then neonatology, and what left, and that growth and development, that part we can do at the end. Okay, means starting with systemic, then neonatology, then an end. Then go for obs gynae. Obs gynae give obs and gynae to differentiate. Obs you can finish in the second revision, I think 2 days. Gynae you can finish in the second revision 2 days. Later when you will go for the third revision, fourth revision, fifth revision, try to complete obs in 1 day, gynae in 1 day, overall 2 days. Okay, fine. Then I think this is where we can end the integration. Biochemistry, I don't think so we can integrate. Yeah, we can integrate with pediatrics a little. Of course, now questions are coming from pediatrics to integrate with biochemistry, especially in the newborn. That's why I have kept to pediatrics, then obs gynae, and then biochemistry. Okay, so we can then also much more of the content you need to keep the biochemistry in mind. If you keep things in mind, you can integrate in a much more better manner. Okay, biochemistry, anesthesia, and psychiatry. These 3 are the small subject. Just after obs gynae, you need to think just I need to take some rest. So better taking rest, sitting idle. Let's complete some few short subject, anesthesia and psychiatry. Finish. Rest complete. Then the comment. Comment is community medicine subject is very, very important. Just now I have seen in this recent FMGE exam, I have seen the questions. Approx 23 questions were there from the community medicine, and it carries a huge percentage in Neetpg 2. So we need to do community medicine subject very, very delicately and important. Community medicine subject, I think you need to keep 3 days, just like in any major subject. For surgery, I highlight combat, obs gynae, surgery, and medicine, because these 4 are the, from my perspective, I think these 4 subjects are the lengthy. So we are completing surgery by 3 days, obs gynae 4 days, medicine 3 days, and combat also I think we need 3 days. And then again ENT, ophtha, FMT, and then again the rest comes. ENT we can complete, ophtha 2 days, okay, 2.5 days. I think I fail for my passivity. Ophtha is quite difficult as compared to ENT and FMT, because ophtha where here we need to remember many things, many diagnoses, many integrations. Is sometimes integration with pediatrics, sometimes integration with the medicine, sometimes integrated with pharmacology, all the medicinal drugs complications. So yeah, ophtha I feel sometimes quite difficult to study, so let me keep for 2.5 days. And FMT is okay, very easy, and ENT. Yeah, combat is very important. You must keep in mind. So this is the sequence. Yeah, in the upcoming videos, I would like to if you want, you can write in the comment section to that what are the important topics you need to know from each and every subject. Okay, from myself, I would like to say that from in the subsequent videos, I will like to make videos on anatomy, orthopedics, combat, ENT, in every 19 subject, whichever subject I feel is important, to mark down the important points of that subject, so that it helps you to better. Because in the upcoming days, when you start your second revision, it helps you to correlate better much with the more important notes. Yeah, the last thing I would like to say that in the second revision, okay, from second revision, whether you can highlight your main notes or you can take the revision notes from any platform you prefer. Okay, my handwriting is very bad, I know. I think it will improve subsequently when I will be more frequently with the iPad. Hope you can understand. Plus, not only revision notes, not only you just revise from your revision notes or highlighting the main notes, you need to consolidate anything. Just like with the therapeutic dose, this one is the therapeutic dose, you need to again give it the maintenance dose. Plus you have to take notes from not notes, actually it's basically, plus you have to study from DBT or BTR, whatever it suits you. I think it's good that, listen, from revision notes you have studied, you have got an overview, and from again if you read the same thing from DBT and BTR, they will add some extra more info, whatever the faculty thinks that it needs to consolidate it there, and you will also read some extra knowledge. So ultimately these revision notes, whatever we are concised, you will get the feel that you have already studied from the main notes. Actually that feeling is important. Yeah, that is not feeling, actually you have read from that main notes. Actually it's very important to you first read with the main revision notes, and then we read with the DBT and BTR. Like for example, if I give you an example for like subject like let's hold for anatomy. You read from any revision notes in the second revision notes, RR, rapid revision, okay, plus DBT or BTR. I think this is the best solution. Or slash one shot is also there from Dbmci. Yeah, that is also there, very good, no doubt. From one shot also. Yeah. So this will be your the main proper notes for the revision strategy. First you got the main notes, then you highlight that, use it as a rapid revision, or you can take the rapid revision notes from any platform, then consolidate it with BTR or DBT or one shot, or if you can consider it with all three platform, whatever it suits you, whatever, how much you get that time, that's you up to. Then anatomy completed, give one SWT, 50 questions, 50 minutes, subject is over. Do this for all the 19 subjects. Which material of which subject or which source suits you better, you can go for that as per your choice. I have given my schedule, my preparation source. I have given one PDF. You can see it in short in my YouTube channel. You can see it. I will give the description of that in this. I will give the link of that in this description. No need to worry. Here, how is your subject ends with each and every. This is how you will end each and every subject in revision time. This all goes for second revision. In third revision, you can. If you're too much confident that you can minimize the time you spend in rapid revision or DVT or BTR, like it will go like just you need to minimize that, nothing else. Read the same contents. First you will get a little bit time more. Read the same thing, you will get a little time lesser, and you will be more confident. So how many revision we told? First main notes, second revision, third revision, fourth revision, and the fifth revision. Fifth revision, you need only to study from, I think by that time you are too much pro, so you don't need to study in fact error also. Just read the 20th copy, that's very important what you made, or better to I say you read from DVT, BTR, one shot, everything, and all the volatile things that you thought that I need to study this before my final exam. I think that would be the best solution, because reading all important things just before exam will not help you at the day of exam. At the day of exam, you just need to memorize, you just need to think. First of all, you need to realize that question. Then you will think about that, where this question comes from, which chapter. Open that folder in your brain. Open that folder. That folder will only open your brain if you that folder settled in your brain. If you read that thing just before 2 to 3 days, you will just forget. That's why multi-way revision is very important. How much content you did, that doesn't matter, but multiple revision of the same thing is very important. When you are keeping all the things multiply in and keeping in that brain, that thing will automatically integrate with everything, and the proper answer will come into your brain, and you can pick the correct option. That's the most important thing, I think, for a preparation strategy. So let's be it for the day. If you want some more preparation strategies or some more subject-wise strategy, some more subject-wise important topics, I will like to do my next video on subject-wise important topics of all 19 subjects. I will and I will send that. You can DM me in my Instagram channel. I will give all that description. I will give all that links and information in my description, and provide not to forget to subscribe this channel, give a like if you like the content, and also follow my Instagram channel. I will give that in my description. There I put every day some new study contents and how to integrate or anatomy, orthopedics, surgery, radio in 2 to 3 4 slides. Okay, to subscribe the channel and hit the notification bell to stay up to date. Okay, thank you for watching. Let me together in the next video. Okay, bye bye.